It's time. We're Facebook Live. Hello, I want to introduce myself to you today. My name is Kathy Griffiths, and I'm the Vice President of Clinical Operations and the Chief Nursing Executive here at Titus Regional Medical Center in Mount Pleasant, Texas. And we're coming to you today live on Facebook because we have a very big announcement for the community. Generally, we would do this in a press conference, but with COVID-19 and really our goal to help stop the spread and do what we can, we didn't want to have a large social gathering. So we decided to do this in a Facebook live event. So we're super excited about that. And today we are going to announce to you that we are the number 6th primary heart attack center in this nation, and also the 2nd center in the state of Texas. So it is just a huge announcement for us. We have put a lot of work and effort into this, and we're very excited about that. And it really aligns with our goal to be a high reliability organization and provide zero harm to our community. And we really, at the end of this, want you to understand what that means. So I think, the team that we have here today, I'm really excited about who we have. They're near and dear to my heart. We all work together on this, and they work tirelessly on the effort. So I'm going to go ahead and just pop them on the screen. They're actually in different rooms. That's why we don't have on masks. It may look like we're not, but we are social distancing. So I'm going to pop them on the screen, and I'm going to let them introduce themselves to you. And the first person is Mr. Jeremy Towns. He is our STEMI coordinator. I'll let him tell a little bit about himself.
Hello, I'm Jeremy Towns. I'm a registered nurse. I work in the cath lab here at the hospital. I also serve as the STEMI coordinator for the hospital. And what a STEMI is just a medical term for somebody having an acute heart attack.
Awesome. And next, I'm going to let you let Dr. Siegel introduce himself. Dr. Stephen Siegel.
Thanks, Kathy. I'm Dr. Stephen Siegel. I'm an interventional and general cardiologist. I practice here at the Heart and Vascular Institute at Titus, and I am the medical director of the newly named Primary Heart Attack Center.
Awesome. And I think now, Dr. Siegel, you're on screen, and I would just like for you to start this off with us and really tell us what it means to our community and really what is a primary heart attack center.
Sure, Kathy, I appreciate it. We know that patient outcomes improve when medical professionals follow the most up-to-date evidence-based guidelines for care. And that's the simple truth behind a drive for continuous care improvement. There is no higher priority for any health system, including ours, than improving the quality of care that our providers can give our patients. The Primary Heart Attack Center is a combined operation that marries the resources of the American Heart Association to define the best possible care for heart attack patients with the resources of the Joint Commission, which is committed to monitor the quality of care and optimize patient outcomes and safety. So to achieve this certification demonstrates a commitment on our part to achieve a higher standard of service for our patients. It provides us with a framework for improving patient outcomes over time and helps us organize teams across our continuum of care. It focuses on a patient's symptoms onset and the first medical contact, whether this be remotely by EMS in their home or on site in another place, or in our emergency room, as well as the operations of the cath lab and our inpatient services to create a seamless system of care for our patients. Some key components that they use in judging the quality is obtaining an EKG within 10 minutes of the patient's first medical contact, stabilizing patients and moving them quickly to the cath lab where we can restore blood flow to a blocked artery in less than 90 minutes from the time of first medical contact, and demonstrating an ability to do this on an ongoing basis, 24 hours a day, 7 days a week. In our particular program, we've taken this further to include early identification of problems before a heart attack occurs, with cardiac screening programs in our community, and with CT scanning to detect calcium in coronary arteries even before patients develop symptoms, in hopes that we can work with patients to prevent their first heart attack. And we've extended the care even further with one of the first intensive phase 2 cardiac rehabilitation programs in Texas to prevent future problems in patients who have already sustained a heart attack. To reach this goal required a cooperative effort and commitment that involved nearly every employee in our health system. not just the obvious departments you might think of like EMS, emergency room, cath lab, nursing, but others you might not immediately consider. Everyone from the PBX operators who initiate our system of care, registration, pharmacy, IT, and a host of other departments as well. So it's really been a commitment on the part of the entire health system to create this. After a year of preparation that involved the entire health system, we underwent a rigorous on-site review by the Joint Commission, including interviews with caregivers and detailed reviews of patients' charts. And this survey not only validated the good care that we were given, but also gave us advice on future improvements that we could make in order to improve the care further, ultimately resulting in our certification as a primary heart attack center. Only 5 other centers now exist in the United States.
That's awesome. I really think you laid that out very well, because we can say that we're a primary heart attack center, but really what does that mean to the community, and what did we have to do to achieve it? And it was a big effort. I can tell you it took a lot of work and a lot of time. I think we need to pop over to Jeremy as the STEMI coordinator, and he can kind of segue into that and talk about, the team. I know for me, just being a part of the team and being able to work with you all to help build it, it was just, I know this kind of sounds corny, but really it was a labor of love for me, because I felt like what I saw happening as we moved along in the process was that our care was being optimized for the patient. And I could see at the end of the day that they were receiving this wonderful, structured, evidence-based care that meant so much. So Jeremy, you've been here for 19 and a half years, and I've just got to brag a little bit about Jeremy. Jeremy is really, we put him into this position and offered him the STEMI coordinator, and he accepted, and he absolutely was one of the top-notch nurses in our hospital. So I just kind of wanted you to know that. So he has just done a phenomenal job of building this. So Jeremy, can you really just tell us a little bit about the team that came together and what we did and what it consisted of to put it together?
Yeah. Thank you, Kathy. Large team, like Dr. Siegel said, it comprised lots of different departments in the hospital. Took months to get it all together. We did get it together, and we met weekly. And what we did was we discussed interventions to help improve all of our processes, and we think we did that. And we think not only have we benefited our cardiac patients, we've also benefited all of our hospital patients through the processes that we put in place. And to help us truly optimize care, we enter our data into the American Heart Association, get with the guidelines. It's a national registry that tells us how we compare to other agencies, other facilities, and make sure that we're just providing the optimal care that we can. I mean, and we're happy to say that we are in line to receive a silver award from the American Heart Association that shows that we're providing the highest level of care that we can for these patients.
Absolutely. That's awesome. So we can say, we have been certified by the Joint Commission with the American Heart Association, along with them in a cooperative environment. And then we can also say that we put this data into this database to really tell us how are we doing. It's not just us telling the community this is what we're doing, but we validate it, right?
That is proof that we are actually doing what we're saying we're doing.
Absolutely. That's what we want to do. That's what we want to give to the community. I think that we'll go back to Dr. Siegel and let him just kind of tell us really, Dr. Siegel, what it means, or give us an example of a patient coming into our health system and why Titus Regional Medical Center would have made this investment, because it was an investment really into the community. What can you tell us, or can you give us an example of a patient that really benefited from that investment?
Sure, Kathy. Well, we have to remember that every 40 seconds in our country, someone has a heart attack. And we know that it's important to try to treat those heart attacks as quickly as possible. We like to say that time is muscle, meaning that the sooner we can restore blood flow to the heart, the more muscle we can save. And by saving muscle, we improve the patient's survival and their chances of returning to a normal life. And that's really what this is all about. So to achieve that requires the type of seamless care that we're talking about today that creates a very efficient system for taking care of heart attacks. And that's what it really requires to become a primary heart attack center. So last summer, for example, I remember we treated a 59-year-old man who had previously had treatment for coronary disease elsewhere and had several stents placed in another institution. But he woke up that morning with chest pain that was radiating from his chest up to his throat, was sweaty all over, felt really bad, and he knew something was wrong. So he called EMS. And when they arrived, they got an EKG in less than 5 minutes after their arrival, and they recognized that he was having a heart attack. As soon as they recognized he was having a heart attack, they were able to alert us from the scene and let us know that they were bringing him into the hospital. They spent less than 10 minutes in his home getting him stable and ready for transport. They brought him to the emergency room 20 minutes later because he was in a remote location. And because we had been alerted ahead of time, we were all ready and available and able to treat him quickly in the emergency room. And so we were able to transport him from the emergency room to the cath lab in less than 6 minutes. He was put on the cath lab table, and unfortunately, before we could even start the procedure, he developed a lethal cardiac arrhythmia, and he died, and we had to resuscitate him. But he was already in our cath lab. We were able to resuscitate him, and then we proceeded to take pictures of his coronary arteries and found that his right coronary artery was completely occluded. We were able to open that artery and restore blood flow to his heart. And that time was only 34 minutes after his arrival in our emergency room and only 64 minutes from the time that EMS had arrived at his house. I've seen that patient in follow-up in our office. He's back to living a normal life again. And that really wouldn't be possible if we didn't have this kind of facility here. It's really doubtful that he would have survived had he had to be transported to a distant location to be treated for this kind of a problem. So outcomes like this are why this effort has been so important to our community, to provide the highest level of care to patients in our community by trained professionals who live in our community with you.
Yeah. Well, I think that story tells it all. It paints a picture of why we wanted to do this, why we wanted to invest in this cardiac catheterization in our cardiac program all the way through with our physicians to our cath lab and everything that we're doing on the inpatient side to take good care of our community. So, and like you said, we never know, but I think it's fair to say that there are patients that wouldn't have survived the trip if we had not got that artery open and restored good blood flow. So I think that, we're in such a terrible time for our country with COVID-19 and everything that we've gone through. And we have evidence on how that disease is affecting patients in their cardiac, on a cardiac basis. And I think at the end of this that we would be remiss if we just didn't give a little message, Dr. Siegel, and you as a physician, and tell the community really a little bit about that. And let's give some education, and I think that we can end with that.
Sure. Well, we know that one of the effects that COVID-19 can have on our body is on our heart directly. So certainly there are heart-related issues that occur with COVID-19, both with weakness of the heart muscle and with formation of blood clots in our body. But beyond that, these are very stressful times for people in general with everything that's going on with the current pandemic. But I want to remind everyone that heart attacks and strokes don't stop just because we're having a pandemic. And national studies have shown that the number of patients presenting to emergency rooms with heart attacks, for example, has decreased by about 38% in our country since the onset of the COVID-19 pandemic. We don't believe that the virus protects us from heart attacks, so that's not the reason for the decrease. The decrease, we believe, is because people are choosing not to come to the hospital to be evaluated because they're afraid to do so.
Right.
And we want you to know that instructions that may have been given to you to stay home or don't come to the hospital don't apply to people who are having acute strokes or heart attacks. We have specific life-saving treatments that are available to treat you, but they need to be administered quickly to be effective for you. So if you're having symptoms of a heart attack or a stroke, we urge you, please don't stay at home. Don't die of doubt. Come to the hospital and let us take care of you.
And I think that we end on that. Absolutely. If you are having a stroke or a heart attack, you need to seek medical care and you need to dial 911. Let the medical community take care of you. They're the experts. Don't try to drive yourself. Just call an ambulance and let them get you here. They give us advance warning. Everything is expedited when you call 911, and I think that's another message that we need to leave you with. But I thank you guys for coming in today and talking with us, and I thank the community for just letting us tell you about our beautiful program. So Titus Regional Medical Center is a primary heart attack center, and we are very pleased and happy to announce that to you today. Thank you.